I want to do a 5 to 7 minutes review of cardiac glycosides. Cardiac glycosides are drugs we use to treat heart failure or congestive heart failure. So now what we have that there was a time around 1785 when a man used cardiac glycoside to treat dropsy or edema, which is edema of the extremities. Now, edema or dropsy of the extremities was linked to kidney and cardiac insufficiency. So what he used was a saline preparation from this white and purple phosphorus. So over time, we found out that what dropsy or edema of the extremity was linked to cardiac to heart failure, cardiac failure or heart failure or congestive heart failure, which is a problem with what the kidney and mainly the heart. So what is heart failure? Heart failure simply means a pump failure. And with heart failure, we have an increase in preload and also an increase in afterload. So what do we have in heart failure? We have an enlargement of the myocardium that's in the heart, which will produce weakness, loss of ability to pump blood into the system circulation. So why is it a pump failure? That the heart cannot pump blood efficiently into the system circulation. Whereas in this congestive heart failure, you already have the heart failure, which was the failure of the pump. Then you also have the failure of the compensatory mechanisms to help that condition, and congestion in the lungs and in the periphery. So heart failure can be of two types, primarily the left-sided and the right-sided. In the left-sided heart failure, what we have pulmonary congestion, which should bring about what shortness of breath, dyspnea, cough, intake. What happens in the left-sided heart failure? What we have is that what blood that should move out from the ventricles, in a way, move backwards and end up pulling in the lungs. So because blood pulls in the lung, blood from the pulmonary system pulls in the lungs, that causes pulmonary congestion. Whereas in the right-sided heart failure, we have blood coming from the right atrium to the right ventricle to go into the pulmonary circulation and into the system circulation. But in the right-sided failure, we have blood pulling in the periphery, which is caused by which leads to systemic congestion, meaning that what blood from the systemic from the periphery cannot adequately move into the right atrium. So right-sided heart failure will cause systemic congestion or peripheral edema, whereas left-sided heart failure will cause pulmonary congestion, shortness of breath, dyspnea, cough, etc. So from here, we're looking at the drugs that we use to treat heart failure. Basically, we use cardiac glycosides. So what is the effect of cardiac glycoside on the heart? Cardiac glycoside would increase inotropic effect. What is inotropic effect? Inotropic simply means increase in contraction of the heart. Cardiac glycoside will also reduce chronotropic effect, which is what? Heart rate. Decrease in heart rate. Cardiac glycoside would also decrease dromotropic effect, which is what? Decrease in conduction velocity in the heart. So what we have is that glycoside, their MOA, they help to inhibit the sodium and potassium pump, preventing potassium from moving to the cell, thereby increasing intracellular calcium ion, which will bring about cardiac contraction. So the goal is that what your cardiac glycoside would increase cardiac contraction by increasing intracellular calcium and inhibiting the sodium potassium pump. So we can also use cardiac glycoside to correct atrial fibrillation or flutter. It is used, one of those are used to do that. But basically, we use cardiac glycoside to control heart failure. Now, looking at our drugs, cardiac glycoside, we have here basically have digoxin and ditoxin as example of what cardiac glycoside. Digoxin is a rapid-acting glycoside, whereas your ditoxin is a long-acting glycoside. So we explain that what digoxin that has an half-life of 36 hours would act rapidly, meaning that the onset of action is much shorter than that of what ditoxin. And for these drugs, we have that 10% of it is metabolized in the liver, 10% is excreted unchanged in the kidney. So persons with hypothyroidism or renal insufficiency would need a dose adjustment to ensure that what drug do not accumulate excessively here. But in case when these drugs are used to treat the CHF, there are cases where toxicity, we have toxicity, where we have detailed toxicity. So detailed toxicity might lead to ventricular dysrhythmias. So in the case of ventricular dysrhythmias, we will need phenytoin and lidocaine for treatment, because phenytoin and lidocaine normally are sodium and are part of the sodium blockers used to treat cardiac dysrhythmias. Now, the toxicity might lead to the first degree, second degree, or complete heart block. Now, to treat cardiac toxicity, we give this. What is the drug here? Digoxin immune fab to treat toxicity. So, what does this drug do? It tends to bind to your cardiac glycoside and ensure that they are excreted in urine, so that thereby reducing their levels. Now, we have other drugs that you could use to treat CHF. We have phosphodiesterase inhibitors here. This is an enzyme. So this drug tends to inhibit this enzyme, so which breaks down cyclic AMP. So what this drug class will do is that they primarily would increase inotropic effects and also increase vasodilatation. Increasing this means that what more calcium will move into the cell and contraction will be enhanced. Whereas increasing this means that what preload and afterload would be reduced. The number of drugs are aminoron lactate, and milirinone lactate. Other drugs that can be used in the treatment of CHF are vasodilators here, that also would act on the blood vessels to increase preload and afterload. We have diuretics here, which normally will reduce what? They reduce blood volume, and by increasing what? Excretion of water and salt in the body. We have ACE inhibitors and A2RBs. What do they do? ACE inhibitors and this other drug class here, what they tend to do, they increase blood supply to the kidney, which will help in the case of kidney insufficiency, and also in a way inhibit aldosterone mechanism. We have beta blockers, which should be used with caution, in heart failure. Now, looking at drug interactions, there are a lot of drug interactions, but the ones that will be important here, some of them are a patient that tends to use a glycoside with a diuretic. Glycoside themselves would inhibit sodium potassium pump, meaning that they prevent potassium influx, whereas the loop and the diuretics normally would increase potassium wasting. So by using these two drugs together, we tend to have an increased loss of potassium ion, which would lead to what? Which might lead to toxicity with the thalates. Also, cortisone prevention also bring about the wasting of potassium ion. So it must be used with caution together. The other drug here is antacid. Antacid generally, because of their effect on the body, prevent the absorption of other drugs along the body. So with this, we have come to a brief introduction of this topic. Thank you.